So let me go ahead and start the asthma. And we're going to start off with a case presentation in this case. So a 29-year-old woman, history of asthma as a child, but then it went away at age 10. No problems with asthma since that time, moves into your town and comes to see you to establish care as a new primary care physician. On her first visit to see you, she had 6 months of persistent, non-productive cough, particularly severe around 2 to 4 in the morning, or when it wakes her up from sleep about 5 days per week. So we know the topic is asthma, but I want to talk a couple of things. Number one, this happens a lot. About half the time, children will, quote-unquote, grow out of asthma, but up to half of those can get it back when they get later on in age. And number two, I want to keep in mind that asthma can be cough asthma, okay, so cough predominant. And number three to point out is that asthma is worse around 3 a.m. Between 2 and 4 a.m., catecholamines, which are natural endogenous bronchodilators, have their lowest effect around 2 to 4 a.m., and so bronchoconstriction can come out. So think about when you do your history on patients, did they have a problem with asthma as a child, number one. Number two, it can not only be chest tightness, wheezing, shortness of breath, it can be cough. In fact, when I was a fellow, I diagnosed my wife with cough variant asthma and sent her to a national expert who happened to be at UPMC where I was, and he diagnosed her. And according to my mother-in-law, I was just helping her study late at night, and that's how I knew that she had 3 a.m. asthma. But I did diagnose her. We were engaged. Nonetheless, we were old-fashioned grandma from Pittsburgh. We had 2 separate phone lines. All right, we'll stop there. So talk about asthma. Inflammatory disorder, airflow obstruction, and often reversible increased hyperresponsiveness. Those are the main things when you're looking at asthma, and that's the definition of asthma. I want you to focus on this. This is a very old slide. I'm using it over 20 years, but it's really important. You have to keep in mind that asthma is a 3-step process. This is extrinsic or allergic asthma, right? There's an antigen, an allergen, something in the environment that's causing this inflammatory number 2 cascade. So it leads to inflammation. The inflammation then leads to the bronchoconstriction and the symptoms, okay? And the point is, I worked in an underserved area for about a half dozen years at East Carolina University in Greenville, North Carolina. We're the only tertiary care center for 1.5 million people. I have people come in, and they were underserved, and they would be taking either nothing or maybe